My name's Josh O'Brien. This is my video for BH1102, 6 skills of the airway and 6 common errors that occur throughout each skill. Okay, the first skill is the putting the patient in the correct lateral position, the unconscious patient. Firstly is to put the arm on the nearest side onto a 90-degree angle, lift up the knee, place the other arm in a neutral position over the chest, roll the patient from the hip and the shoulder, placing the arm under the patient's head and the other arm out in front, and the knee up to a 90-degree angle to the body. Common error with this skill is to not have the knee at a high enough angle. If the knee is too low and the angle is not high avough, patient can tend to roll forward, and this can occlude the airway. Also be careful to empty the pockets to avoid any injuries to the hips or the legs. The next skill is the jaw thrust, chin lift and triple airway manoeuvre. First step is to put a towel under the patient's head for the adult patient to get the natural position, curvature of the spine correct, and to get the best angle to observe. To do a chin lean, a hand on the forehead, pistol grip on the chin, get the angle of the head right. To do a triple airway we need our last 3 fingers around the corner of the mandible, thumbs on the maxilla, index fingers on the point of the jaw, push down and create an angle to observe the airway and look down the throat. The next skill is to insert an OPA or oropharyngeal airway. This first step of this is to get the measurement correctly, to get the size right. This is done by measuring the length from the corner of the mouth to the corner of the mandible. This is the correct size. Lubricate with either the patient's saliva or water will suffice. The first insertion is against the curvature of the airway, to go in about halfway and then rotate 180 degrees from halfway and have the flange of the airway resting just above the lip. Common error in this skill is to measure the size of the OPA incorrectly. This can occlude the airway even further and potentially cause injury to the patient or be completely ineffective. The next skill is to insert an NPA, nasopharyngeal airway. Firstly, this needs to be lubricated. Usually this is done with KY jelly for the purpose of mannequin piece of spray. Again, it needs to be measured from the corner of the nostril to the corner of the earlobe. This is the correct length. Also, width needs to be measured against the size of the patient's nostril. Once lubricated, you need to point the nostril slightly up. Choose the widest nostril to insert it into, and when inserting, always point down the natural angle of the airway. Rotate 45 degrees each way as you go further in, and again rest the flange just slightly above the edge of the nostril. A common error with this with paramedics is often to have an obstruction and to continue trying to push past the obstruction. This is obviously incorrect, can cause further damage to the nasal cavity if there is damage already. If you do feel an obstruction, always pull out and either try a different nostril or avoid the procedure. Next skill is to perform a laryngoscopy. So using the ringscope, firstly check the battery is charged and the light works. Ideally they will. With your left hand, always anchor the patient's forehead with your right hand. Insert on an angle to the right side, to the paramedic's right side of the mouth, inserting slowly and gently, and leave a centimetre or 2 away from the patient's entrance to the patient's mouth. Applying pressure down with your right hand and a gentle lifting pressure with the left hand will give enough of a viewing area. A common error with this, with paramedics, is to lever at an angle with the ringscope. This is not correct. This can damage the patient's front teeth, often break them. The The next skill is assisted positive pressure ventilation. This is done firstly with the mask. The most important thing is to get a proper seal over the patient's mouth and nose. This is probably the most important step, especially when you're getting set up. Once a proper seal has been attained, you want to squeeze back for ventilation approximately halfway for an adult patient, and observe for proper airway into the lungs by looking for chest rise and fall. For a rate of 12 breaths per minute, you want to ventilate it approximately once every 5 seconds, which we'll do now. A common error with this is to not get a proper seal around the mouth, and this will not deliver any or adequate air into the patient's lungs. Won't see any rise and fall of the chest, and essentially won't be achieving anything.